I'm Dr. Sandra Fox. I'm the director of the Lions Low Vision Center of Texas. The Lions Low Vision Center of Texas is a collaborative effort between the Lions International and the University of Texas Health Science Center at San Antonio. It's also a joint clinic between the Department of Ophthalmology in the School of Medicine and the Department of Occupational Therapy in the School of Allied Health Professionals. We're going to talk a little bit about the emotional aspects of vision loss. When we look at what we want in life, what we want is this. We want to be able to enjoy a high quality of life through mutually satisfying interpersonal relationships and make meaningful contributions in a manner that allows us to value ourselves and be valued by others, family members, friends and neighbors, and society as a whole. And this is what all of us want out of life, and it's what our loved ones want out of life as well. When someone loses their vision, they immediately feel as if they are no longer valuable. They immediately feel as if they are a burden to their family and friends. So they're no longer contributing. In fact, they're a burden. They go through all the stages of grief that we go through when we lose a loved one, and the loved one that is lost is the person that they were prior to losing their vision. They may become reclusive since they are no longer able to participate in social activities like playing cards, bingo, or dominoes. When driving is no longer an option, they may become cut off from family and friends. The loss of independence is the biggest loss, and that is the person that they grieve, the one that could drive, the one that could play cards, shop alone, and required no assistance. There are several models that talk about the stages of grief, but all begin with denial as the first stage, and they all include bargaining, anger, depression, and eventually acceptance. Just knowing that it's normal and expected to experience this grieving process is very helpful to the person with vision loss and the family members. I have a handout that talks about the emotional aspects of vision loss that I give to the family members to go over with my patients. And again, just knowing that this is normal for them to feel this way is very, very helpful. Counseling is strongly suggested to help cope with the emotional aspects of vision loss. A lot of people may be resistant to counseling, especially those patients that we have that are from that greatest generation. You know, they're the ones that went through the Depression and went through the World Wars, and it's, you know, pull up your bootstraps and you just keep forging forward. So they tend to think of counseling as a weakness or a failure, that they're just not able to overcome this. So what I do is I discuss counseling as simply having an impartial person to talk to about their vision loss. I talk to my patient and I remind them that I'm sure that there are things that they just don't want to discuss with their family members because they don't want to scare them, they don't want to burden them with anything more. I talk to the family members about, you know, I'm sure that you get to the point where you just kind of wish that you didn't have to just keep hearing the same thing over and over, or you wish that you had better skills to make your to have the right words to say that would make your family member feel better. So I stress that having a professional to talk to, someone else to talk to, instead of friends and family members, allows the person to speak more freely. And I tell them, you know, a good way to think about counseling is just that it's your insurance paying for you to have someone to listen to you talk about your vision loss and how you're feeling. And when I've discussed this with my patients in that way, I really have had very few patients defer counseling. Support groups, I think, are critical for patients that have vision impairment. Social support and contact is associated with less depression in older adults with low vision. It's crucial for those with vision impairment to have contact with others with vision impairment so that they don't feel so alone. Many times they feel like they're the only one with vision impairment. You know, if they're a senior citizen and they have vision impairment, I am quite certain that they have friends that also have vision impairment, but they don't talk about it. They don't like to mention it to their friends. I had a patient one time that was no longer playing cards with her bridge group because she could no longer see the large playing cards. And I asked her, well, they weren't using large playing cards, and so she couldn't see the regular playing cards. I asked her, well, how old are the people in your group? And she said, well, they're all about my age. And as I said, she was a senior citizen. I told her, you know, if you have a group of 20 people playing bridge. I can guarantee you, you're not the only one that has vision impairment. Why don't you take a deck of large playing cards? And I'm sure that you're going to find someone in there that's going to be appreciative. The next time I saw her, she told me that hers was the most popular table because there were many people that were having difficulty seeing the cards, but nobody wanted to say anything. And that's the advantage of a support group. I think it's also important for the family members to participate in the support group as well, because now they have contact also with other family members that are dealing with the same thing. So I have found that participation in a support group may be the single most significant factor that contributes to successful rehabilitation. Belonging to a support group allows the person with vision impairment to be around people that know exactly how they feel. There are mentors there that can give the person with new vision loss practical suggestions. You know, the been there, done that. This is what I've tried. That worked for me. This is what I tried that did not work for me. Meeting others with vision loss that have worked through the grieving process and are now able to function well in spite of the vision loss is inspiring and gives hope. We talked earlier about the person that they grieved is the person that they were before they lost their vision, the person that was more independent. So if the person with vision impairment can learn to do things another way through low vision rehabilitation and become more independent, their emotional state will substantially improve. So we focus on specific tasks that the individual would like to be able to perform, like reading the newspaper, watching television, surfing the internet, sewing, cooking, again, whatever it is that they would like to be able to perform. We may talk to them about tasks that are really not going to be able to be met. For instance, if they would like to be able to drive again and driving is just not going to be safe for them. Instead, we talk about transportation alternatives. Via Trans, we have several services in the community that offer some transportation. So even though the patient may not be able to perform the task themselves, we try and find alternatives that will allow them to get the job done. By using low vision devices and or compensatory strategies, the person with low vision may be able to get back to performing daily activities that they could not perform prior to rehabilitation, such as managing their own medications and their finances. Many of my patients have home health just for the purposes of giving them their medications because they're unable to do that themselves. They simply cannot read their medicine bottles. They can't read their Bible. They can't do things that they want to be able to do. Well, what if we could get them to be able to read their medicine bottles? What if we could get them to be able to draw their own insulin? What if we could get them to check their own blood sugar so that they could know exactly where they're at and they could manage their eating habits a little bit better? That would eliminate the need for home health. Many patients are not comfortable with having other people manage their finances. You know, they just would rather do that themselves. They're just not comfortable with family members, or sometimes if they have no family members, they have to rely on friends to manage their finances. What if we could help them be able to do that by themselves as well? Again, they'd be more independent. So those are the goals that we focus on. It's important for family members to understand how important it is for their loved one to be independent. I think many times children, especially if they have a parent that they just love dearly, they want to do everything for that patient that has lost vision out of love and respect. You know, I hear, you know, Mom took care of all of us all of these years and now we're just going to take care of her. However, allowing the parent to remain independent in as many areas as possible without sacrificing safety really is the best strategy. So what can you do to help? Talk with your family member about what they would like to do for themselves as well as when they would appreciate help. For instance, there are some tasks that someone may want to delegate. Take cooking, for example. Some women, I think my mom is a good example of this. She's cooked for many, many years with 5 children and a husband. She's to the point now where she would just as soon let somebody else do the cooking. However, for other people, cooking is a hobby, and having to give that up is really going to be debilitating for them because they're going to feel like they're not able to enjoy life as they did before because that was their big enjoyment. So talk to your family member. What is it that you would like to be able to do that you can't do now, and what is it that you would like for us to do for you? Seek help through low vision rehabilitation and let the doctor and the therapist know the specific tasks that your family member would like to be able to perform. If you can accompany your family member to the low vision evaluation and to therapy, that would be very helpful. Sometimes the family member won't speak up about things, and sometimes the person with vision impairment won't speak up, and we need the family member to help let us know what's going on. Try to recognize the stage of grief your family member is in, whether it's denial, anger, or depression, and suggest counseling if needed. I think it's really important that you recognize these stages of grief and understand where your family member is. If they're in denial, they may not be very willing to accept low vision rehabilitation. Some of the signs of denial would be continuing to go to another eye doctor for a second opinion, a third opinion, a fourth opinion, always thinking that I just need to get a new pair of glasses. When patients are in denial, they're usually not willing to try devices because they really feel like they just haven't gotten the right pair of glasses or the cure for their disease. And that's okay. Let them work through that. Show them what's available. Eventually, they'll get to a different stage of grief, and they'll be more willing to accept the devices. One of the things that we really do advise our patients to do is to learn as much as they can about low vision rehabilitation and as much as they can about the eye condition that has caused their vision loss. For instance, if they have macular degeneration, learn as much about macular degeneration as you can. Become an advocate. Make it your responsibility to talk to others about low vision rehabilitation, to talk to others about macular degeneration. Learn to educate other people about what help is available. When people do that, they suddenly feel like they have a purpose. And again, if you go back to what we talked about, the goal of most people is to feel valuable, and we want to contribute to society. And if you can become more independent, if you can become an advocate for low vision rehabilitation, if you can become an educator to other people about low vision rehabilitation and ocular disease that causes vision loss, then suddenly you do have a purpose. If you would like more information or have any questions, please feel free to contact me at my email address, foxsm@utusca.edu. Thank you.